Hello, my name is Nina Solis, and I am a University of Michigan student nurse at Glacier Hills Rehabilitation Center. The patient I will be reviewing with you today will be addressed by her initials, KC, or simply by patient. KC was born on May 3rd, 1947, making her 67 years old today. She is a Caucasian female who has obesity and currently weighs 406 pounds. She is divorced. Before retiring, Casey held a job at Eastern Michigan University as a project manager and has 2 years of education above a master's degree. Patient normally seeks care with her primary physician at Integrated Healthcare Associates. Patient was transferred to the University of Michigan Hospital emergency room after reporting a chief complaint of a soft tissue infection with pressure wounds as a result. The pressure wounds are located at the left gluteal region and at the midline abdomen region. Patient recalls the abdomen wound developing first around December. The most aggravating factor for her wounds was sitting for long periods of time and reported her pain would sometimes be at a 10 out of 10 intensity. No alleviating factors were described. Before being admitted, the patient described being able to perform daily activities of living until she could no longer care for the wounds herself. The patient was then transported for rehabilitating care and increased pharmaceutical interventions at Glacier Hills after developing pneumonia on January 27, 2015. Recently, her wounds show no pink or red tissue, with no granulations or odors. Additionally, her left gluteal wound is 2 inches long and 3 inches wide and is dressed 3 times daily. Her midline abdomen wound is 4 inches long and 2 inches wide. With this wound, patient utilizes a wound vac that has serosanguinous fluid draining into it and feels the most pain when the wound vac is being cleaned or when her wound is being redressed. Vital signs. The patient's vital signs are stable at this time. Blood pressure is 120/88. Respiratory rate is 12 breaths per minute. Pulse rate is 76 beats per minute, and her temperature was 98.6 degrees Fahrenheit and normal room temperature. Past medical history. The patient denies having any childhood illnesses, but reports having aortic stenosis, hypertensive cardiomyopathy, hypothyroidism, mitral insufficiency, depression, anxiety, osteoarthritis, endometrial cancer, morbid obesity, obstructive sleep apnea, and a colonic cyst. The patient has not been up to date on her immunizations. The patient's allergies include Cipro, tape, and strawberries. When in contact with tape, the patient described having a huge rash everywhere. With strawberries, patient described breaking into hives. The patient has not come into contact with Cipro recently, and she does not remember her reaction to it. Past surgeries. The patient described having a transabdominal hysterectomy in 1983 due to her endometrial cancer. Patient also had a vitrectomy in 2009 and a tonsillectomy. Current medications. At Glacier Hills, Casey is currently taking multiple medications such as furosemide, 40 milligrams tablets orally twice daily, acetaminophen, 650 milligrams tablets orally daily, and a variety of vitamins to boost her health. Functional assessment. Patient describes her diet to be full of low fat and low cholesterol. Patient identifies herself as a vegan. She denies any recreational drug, smoking, or alcohol use. In terms of assistive devices, patient utilizes a walker, cane, and/or a wheelchair to aid in her mobility. Due to her obstructive sleep apnea, patient utilizes a CPAP machine when she sleeps. When she was afflicted with pneumonia, she used a therapeutic spirometer to aid in her breathing. Because of her 2 pressure wounds, she utilizes a wound vac, as aforementioned. Casey now exercises at Glacier Hills through physical therapy and occupational therapy, such as playing Wii Sports, but did not exercise previously in her original home environment. Psychosocial data. Casey is not very close with her family members, but revealed that she has 1 older brother at the age of 80. She lives alone. She is divorced but has 1 son that lives in the Ann Arbor area that visits and frequently helps her out. She also has a visiting nurse that comes to her home 2 or 3 times weekly, and patient reports having a friend who comes over periodically as well. Patient reveals to be religious and personally identifies as a Mormon who practices avidly. Casey has an educational level of 2 years above a master's degree and is seeking to attain a PhD. Family history. The patient's mother died of a myocardial infarction, and her father passed away from esophageal cancer. Her older brother is 17 years older than she is and has been described to be in good health. Her paternal grandparent on her mother's side has diabetes. Her uncles on both her mother and father's side died of heart attacks. Her only son is described to be in good health. Review of System 1, integumentary. Because of her severe tissue infection in the form of pressure wounds, the integumentary system is a crucial system to look over for this patient. Patient described extreme dryness on her legs and feet, and its first onset was a couple months ago. Casey reveals the presence of rashes found on chest, which take on a bruise-like appearance because of her low blood platelets. Patient revealed itching which started within this past month, March 2015, primarily in the integument wound around her abdominal midline wound. Skin conditions include cellulitis and mastitis on her right breast. Casey does not spend long periods of time in the sun, and she does not frequently apply sunscreen. Patient denies any apparent changes to her hair, nails, or skin. One area of concern that the patient brought up was her swelling legs. Upon assessment of her integument, her scalp showed signs of flanking, but no lesions were present. Her scalp and body revealed to have equal hair distribution, color, amount, and texture. The color of the patient's hair was graying and thinning due to age. Patient revealed adequate cleanliness and did not have an excess of perspiration. No body odor was present. In terms of color, the patient revealed to look paler. Despite lacking moisture, the patient's skin felt to have normal thickness and texture. 2 soft tissue wounds were present, one in her midline abdomen and one in her left gluteal region. Body temperature was consistent, both throughout and bilaterally. Elasticity and turgor of her skin was normal. On closer inspection of her lower extremities, edema was present and graded as a +4. This indicated a sign of possible venous insufficiency. Both her fingernails and toenails showed intact nail hygiene. The color, shape, contour, thickness, and attachment all turned out normal. The capillary refill of her fingers was below 2 seconds, whereas the capillary refill of her toenails was approximately 4 seconds. Review of System 2, respiratory. During a respiratory interview with the patient, it was revealed that she had recently gone through a recent bout of pneumonia and was having some labored breathing. In addition, during auscultation of the lung fields, wheezing was present. Because of these things, it is also necessary to look into the respiratory system as a system of importance. Casey reports having a shortness of breathing, saying, "Breathing lately is worse than normal, and breathing has gotten harder over the past few months." Patient reveals that breathing gets harder during activity and only frequent periods of rest alleviate it. Although the patient has labored breathing with activity, patient said she does encounter wheezing but does not feel any pain. Patient has a history of pneumonia, but none with bronchitis or asthma. Patient is not currently coughing up sputum and does not have frequent upper respiratory infections. Patient denies any family history of respiratory disease or taking immunizations to prevent catching respiratory diseases. Her weakened ability to breathe has begun to take a toll on her activities of daily living and reports having a loss of energy over the past few months. Upon closer inspection, the color of her thorax was the same throughout with a transverse diameter of 2:1. No injuries or deformities were present, and her thorax was symmetrical. Her breathing pattern was mildly distressed. Patient was able to breathe deeply, but it appeared labored. Casey's trachea was midline and moved up and down in a normal fashion when swallowing. Her posterior chest expanded normally and equally when breathing normally. Tactile fremitus on her posterior chest revealed no abnormalities. Upon auscultation of the lung fields anteriorly, laterally, and posteriorly, wheezing was present on the lower right lung both anteriorly and posteriorly. Bronchophony, egophony, and whispered pectoriloquy revealed areas of consolidation around the aforementioned lung fields. Pertinent system number 1, cardiovascular. Because of Casey's strong family history of myocardial infarctions and being diagnosed with a mitral and aortic valvular disease, accompanied with cardiomyopathy within this past year, the cardiovascular system proves to be a system worth investigating. According to the British Heart Journal, 29% of people with a heart disease had a close relative undergo a heart attack before 60 years of age. Based on a randomized sample of 1,044 people, having a family history of a heart attack showed a significantly more likelihood for the subject to have a heart attack themselves. The data was based on smoking, weight, height, plasma lipid and lipoprotein concentrations, blood pressure, and resting and exercise electrocardiograms. Subjects with a higher total cholesterol, higher blood pressure, and higher density concentration of lipoprotein cholesterol had coronary heart diseases. Because Casey has both a strong history of cardiac diseases and has obesity and a high cholesterol of 110, her chances of encountering a myocardial infarction or another disease are very likely. Pertinent system number 2, peripheral vascular. Because of the graded 4+ edema on the patient's lower extremities and due to being morbidly obese, it is very possible that Casey suffers from some type of venous insufficiency, thus making the peripheral vascular system another important system to observe. According to Bellen's observational study on venous insufficiency, thromboembolic disease, and obesity, morbid obesity is associated with multiple comorbidities which can include venous insufficiency. In this study, the results showed that women who were morbidly obese and had edema grading on their lower extremities of 3+ or higher had developed a type of venous insufficiency called distal venous thrombosis. Casey's feet were swollen, and the patient describes having sharp pain in her legs. When walking, her pain is graded as a 10 out of 10. When sitting up, her patient is described as a 7 out of 10 or an 8 out of 10. Only when sitting is her pain the least intense with a rating of 3 out of 10. Along with experiencing hardening of the skin, KC's symptoms are very heavily correlated with venous insufficiency.